Hello everybody, my name is Dr. Eric Liss. I'm a chiropractor in Mission Viejo, Orange County, California, and I'm talking to you today about frozen shoulder and what I do in my office to treat frozen shoulder, and a little bit about active release techniques, which is the soft tissue technique that we're using. Frozen shoulder, its causes are, a lot of the causes are unknown. A lot of diabetics get frozen shoulder, people with circulatory issues, cardiovascular issues, lung issues, fibrosis of the lungs can also cause frozen shoulder. Mostly, a large percentage of frozen shoulder is caused generally by an injury to the shoulder joint, which causes a lack of movement over time, and this lack of movement will cause a fibrotic scar tissue formation in the shoulder capsule. So frozen shoulder is also known as adhesive capsulitis, and so we're talking about an inflammation and a thickening of the shoulder capsule. Now the shoulder capsule, to get to it manually by hand, which is what we want to do, what you have to do is go deep inside. The best way to get to it is through the muscles, in between the muscles rather, the pec major, the deltoid, underneath that roof, or through right between the lat muscle over here. That's the best way to get into the capsule and really get deep in there and put a pressure on that capsule and try to peel away. We're actually trying to peel away the scar tissue. And if you picture the capsule, if you picture the fibers, the little microscopic fibers that are running through the capsule like this, and you have these fibers that move, and this is how the capsule moves, is these fibers actually go back and forth. When the fibers get crossed up like that and stuck together, that's when you'll get a lack of movement or a frozen shoulder. So what we're doing with active release techniques is we're going in under the arm into the capsule, where we're finding the fibers that are like this, we're maintaining a pressure on the capsule very deep and then peeling away. So we're actually going to get the fibers in the capsule to actually reorient themselves and look like that. And over time we can really get the frozen shoulder to release and get full mobility back into the shoulder. A lot of people that don't have the correct treatment for frozen shoulder, over 2 or 3 years that shoulder will thaw out, or you know, the frozen shoulder will go away, but they'll report not having as much range of motion as they did previously. And the problem is that they never had any kind of therapy where somebody went in and actually got rid of, manually, by hand, got rid of the scar tissue formation in the actual shoulder capsule. So that's what we're doing in this office with active release techniques. I have a lot of success with frozen shoulder, a lot of experience with it, and we're using this technique to go in and break up these adhesions, and we're fixing frozen shoulder permanently and effectively.